For many years, two hospitals operated in Owensboro. The Davis County Hospital was a public hospital with a statutory duty to provide care to the indigent. Mercy Hospital, owned and operated under the auspices of the Catholic Church, served the public and provided indigent care in accordance with faith doctrines. The operations of these two entities were conducted separately in a county with a population of less than 100,000 residents. In the early 1990s, changes in financial circumstances at Mercy led its board of directors to consider a possibility of a merger. After much time was spent deliberating the idea, a conclusion was reached. The independent boards of the two hospitals decided that the two entities should merge. The new combined entity would be privately operated, but adhere to all doctrinal dictates of Catholic faith. When the two hospitals of Owensboro merged, a new board was constructed. This board adopted a mission statement that the Owensboro medical health system existed to, quote, heal the sick and improve the health of the community. The new corporate logo, showing a figure circled in an embrace, symbolizing care, but was also intended to reflect a vision that new models in healthcare delivery and overall healthfulness would be promoted and adopted by the board. The legal merger of the two hospitals was completed in 1995. When Greg Carlson, former CEO of the Owensboro Medical Health System, first moved to Owensboro, he came across an article in the Messenger Inquirer about what Owensboro needed the most. One of the things was a competition-sized swimming pool. He decided to contact the mayor, the county judge executive, and the leaders of the city, county, and Catholic schools. Carlson told me that, and I quote, the suggestion was that all organizations should work together to build a pool. I suggested that they proceed and the hospital would be a supportive but not an active partner. Those who had been contacted discussed the matter and came to the conclusion that they did not have the funds. Carlson decided to view the potential project from the view of the hospital and the perspective of the community. A study of health problems of citizens in the area showed that, compared to the rest of the nation, Owensboro residents had a higher death rate due to stroke, cardiovascular disease, and type 2 diabetes. The plans for the health park began to take shape in 1995. The $14 million, 110,000 square foot facility was intended to provide the city of Owensboro with a central hub that incorporated the new forward-looking model for delivery of health care. This model was based upon a belief that wellness included physical, mental, and spiritual components. Accordingly, the facility would offer a venue to community members where they could work to improve physical well-being through exercise, treatment, and education. A chapel was incorporated to honor the location that once was Mercy Hospital, and also to permit those seeking guidance through faith to gather. Health and wellness education programs were to be offered to all area residents. The Owensboro Medical Health System opened the new Health and Wellness Center, the Health Park, in October 1998. The vision of the community leaders who supported the new health park would be not only to treat health problems, but to make great strides in disease prevention, either through increased fitness, development of more healthful habits, or better educating patients on his or her conditions. Carlson had worked very hard, along with many others, to help persuade the public that the future of healthcare was in wellness and disease prevention. The health park would create an atmosphere that would allow the community of Owensboro to better the health of its citizens in this manner. Carlson is quoted on how he addressed the community concerns that the health park may have a negative impact on the Y. We worked with the Y to collaborate on the development of programs, such as swimming courses for all the schools. We promoted to use both the Y and the health park. Also, the economic prosperity that the health park has helped bring to Owensboro is astounding. Quote, a number of realtors, business leaders, and local politicians shared with me that the health park was one of the best assets in the community when they were recruiting people to Owensboro. End quote by Carlson. Along with its hosting of swimming events and other community events that bring hundreds of people who stay overnight using hotels, eating at restaurants, and shopping at other local businesses, it was great for the economic development of this area.